Welcome to a new episode of Behind the Numbers with Kevin Parent, the social media lead for Ottawa Public Health. OPH has risen to one of the top public health accounts on Twitter, gaining the trust and following of over 115,000 people. You may have seen their threads explaining important COVID topics, their humor-based combats against circulating myths, or their recent revelation that their intern Bruce is really Ryan Reynolds. We had a great discussion centered around science communication, focusing on the biggest difficulties of it, as well as advice from Kevin on how to be a good science communicator. Hope you enjoy. So first I want to say welcome. I'm very excited to have you on and so excited that you said yes to coming on.
No worries. No worries. It was fun. I've seen a few of your of the tweets and that, and I love what you're doing with like the science comms angle and that. It's great seeing people talking about it.
Thanks so much. Yeah, that's actually a big reason why I want to talk to you, because you do such a good job. First, we'll do we'll have the introduction already playing, so people will already know that you're basically the guy behind like Ottawa Public Health, social media communications. You're the guru. Contrary to popular belief, I'm not interviewing Ryan Reynolds.
Right? Oh my goodness! I still can't believe that happened. Like that's the most real thing ever.
I'm going to want to go into like how the whole Bruce thing came up, but first I want to know, how in the world do you get Ryan Reynolds to do that?
It was genuinely just the most like random, wonderful little moment. Tuesday of last week, he sent us a DM on Twitter. Just because like we've had interactions with him and a few of his brands before, and then we just got just a message in our DMs. You guys are very good at what you do, love what you're doing, and we were so blown away, and we said thank you. And then later on that day, we had the idea. And you never want to be those people, that like somebody says something very kind, and then but we couldn't resist, so we had the idea, and we sent it, and he agreed. We wrote a script on Wednesday. We sent it to him. He sent us back the raw cut video Wednesday evening. Thursday, there was so much going on. We were all so busy anyway, so we managed to on our side, like on our lunches or on our breaks, just get the video packaged up, and then out it went to Friday morning. And I still can't believe it's a thing. Like
what the first time I watched it, I remember going through and I was trying to find like when is it gonna be sort of altered, or when are we gonna tell this is fake? And then he says like, yeah, I'm from Ottawa Public Health, and I was like, wait. What?
Oh yeah. It was mind blowing for all of us. I mean, he'd just what an amazing human being to begin with, that he did that, and that he was willing to help share the health message, et cetera, et cetera. It's a cause that's dear to his heart, and we are forever grateful. It's the most successful thing we've ever posted on our social media channels. Which is hilarious because
you're already well over like 100,000 followers. So
yeah, I think we're creeping up on 116 now. And the new Super Bowl tweet was the biggest thing we ever posted, and then this thing just blew it out of the water. But it's been a wild 12 months.
So then that's actually a good segue. So the Super Bowl tweet, that was kind of how this whole Bruce thing all started. So for anyone who is listening and hasn't seen it yet, basically there was the tweet after the Super Bowl saying, congratulations. In brackets it said, Bruce, please enter the winning team. And then there's this photo. And the thing I love, why it's going to tie in so well to this conversation, is that then you go on, there's a thread of tweets, and it's basically pointing out all these things of like, everything you see on the internet isn't real. Mm-hmm. And sort of this, like looking at this tweet, it's hilarious. Everyone's believing that we have this intern Bruce who screwed up. But if you actually look and actually like check out the facts, you can see so many things of why this isn't real. Mm-hmm. And so that's kind of where I want to dive in first, of like the difficulties of science communication and of being sort of a government platform where there's already a lot of trust issues in terms of who we believe, what's going on, what's even in terms of this pandemic, what's actually like, like all this, we don't know what's myth, what's fact. And so I want to start off with like your biggest lessons that you've learned while running this account, and sort of the lessons that you've learned of what to take away for good science communication and how to engage people, how to get people to trust you.
Okay. all sorts. I mean, tons and tons with that one. And yeah, so the brief backstory to contextualize Bruce, because it kind of leads into all this. I mean, our first Super Bowl messages went out, I think, the Thursday before the Super Bowl weekend, and we took the humble approach. Like, we're a municipal public health account. We're not cool. We're not a cool, fun brand. So, like, our post used wording like, when you were watching the sporting event this weekend, and it was just this whole thing. And so that's where the Bruce thing came from, was this entire notion of, like, we're not a cool brand, we're not really into the Super Bowl thing, so we probably mess it up somehow. And then the Bruce tweet was just a blatant bait for engagement. We were just trying to get people to interact with us, which we did. And then sure enough, yes, Monday morning, we noticed that there were a few people that had taken it quite seriously. Like, people legitimately were saying, like, oh my goodness, like, Bruce is going to get fired, and you guys can't even run your social media account properly. And so around 10 o'clock in the morning on Monday, we were like, you know what, this might be a fun time to pivot, because open confession, the plan was never to make this a lesson about misinformation. We just saw the opportunity and decided to run with it. And sure enough, yes, we did that little thread where we pointed out, here's the pretty obvious thing, like the image. Come on. Like, why would we make an image and put in insert logo here so that somebody on Sunday night at 11 p.m. has to Photoshop that line out just to, like it, there were so many things about it that just didn't make sense. So we ran with it, and it was a great lesson in misinformation. And most of our overarching strategy for science comms is based on that. Like, we watch everything. We read all the replies. We read all the comments. We tend to use that to build our content. We gauge moods. We gauge feel. We look for areas where people maybe aren't quite with us on something. Like, I don't know if you've ever done any public speaking, but one of the best parts about public speaking is you can use you use the first two lines of your audience, like first two rows, of your audience, and they're your gauge. If you're explaining something and everybody's looking at you like, what? And you're like, okay, I need to keep going. But if everybody's nodding along with it, and you're like, all right, on to the next point, let's go. It's the same thing with our social account. We're watching how people are replying to things, try to get that feel. And when we dig into misinformation, it's always based on that. All of our most successful misinformation posts have been based on something that's being talked about online, and we're staring at it being like, really? So then we're like, okay, let's go address it. Like, we had one not that long ago that said there was little asterisks, the check splitter sees all the tweets saying we're in bed with big pharma and getting millions of dollars in payoff.
Oh my God, that was
yeah, it said, closes Twitter, proceeds to fill out form requesting $17 in budget approval to promote a tweet. It's that thing where we'll accept whatever the conspiracy theory or et cetera is at face value, and then deconstruct it like that. Because P.S., where are our millions? Like, where are all of our millions? I mean, seriously, I would have a full head of hair and plugs and everything else if Big Pharma was dumping money at us. Like, and we had one of way back in the pandemic, we said, the notion that COVID-19 is a global conspiracy involving every nurse, doctor, paramedic, health practitioner, and government organization on the planet represents a very optimistic view of project management.
Yeah.
Like we're the government. This is not, so it really is that. Like, it is the biggest lesson for us is just, you have to constantly be watching and listening to your audience. You need to be, what are people saying? How are they feeling about something? And then go meet them there. We had a poop thread a couple of weeks back. We had an entire thing, and the lead-in was a government agency is tweeting about poop. What a time to be alive! And it was our way of trying to explain the wastewater analyzing that we're doing, because people were saying, we were saying, hey, levels are going up. We need to be concerned, and the audience was saying back, yeah, but hospitalizations aren't that bad, et cetera, et cetera. We're like, okay, how do you explain lagging indicators? And so we found a way to kind of walk people through it in a logical way. And so, yeah, you have to always be listening.
That there's a couple of things that leads to. So one, I love the humor that you guys use. I know that's what drew me initially to being like, this is it. I think you guys and Johns Hopkins are my two favorite public health accounts right now. And I shut off all the news, and you two accounts are the only ones I follow for what's going on. Because I found a lot of other ones, there's so much shaming, blaming, judgment put into the messaging that you kind of look through it and you're like, okay, I know what's going on in the world now, but I feel so crappy and horrible. Whereas you guys, like, I'm learning while, like, it's informative, I'm learning, but it's so funny at the same time that it brings a little lightness to the already, like, mass dread that's going on.
Yeah, it brings levity for sure.
Yeah, which I think is probably a big thing in terms of engagement. Like, anything right now goes viral because you're like, there's something that actually made me laugh today, rather than scaring me to hide in my basement.
Well, and right, and you know, social media is such a busy place. I mean, you know, platform to platform, Facebook not as much, but, you know, Twitter especially. Twitter's so busy. There's so much going on, and it's just that notion of, you know, the messaging coming out of public health units. It's so important. I mean, even pre-COVID, the things that public health units have to say are very, very vital. But it doesn't matter how important your message is if nobody's paying attention to it. You know, so it's always engagement first for us. It's we need to get your attention, then we can deliver a message and move on. And I mean, yes, you know, as you said, there's a lot out there. There's a lot of negativity. We tend to follow evidence, you know, public health, evidence-based, big shock. You know, and, you know, pick your crisis communication theorists. You know, in Ottawa, Josh Greenberg has done some wonderful stuff. Internationally, Peter Sandman's another one to follow, and they'll all talk to you about the importance of communicating with, you know, empathy and transparency and humanity and openness when you're talking to people during a crisis. So, you know, even the times when we have to be very candid. You know, we've had a couple of posts that were like, you know, when we talked about. We had a post back in July. It said, you know, mandatory masks were not ordered by the cashier at your local grocery store. You know, we understand if you were upset, but please direct your anger towards us and not at retail staff. You know, like there was an element of shaming in that post, but we needed to approach it in a way of like, yeah, we understand you're upset. It's perfectly okay to be upset. Just direct your anger at the right outlet. You know, so it's so important to have that empathy when you're talking during times like these.
And I have a lot of friends who work in like the restaurant industry, and I remember when that tweet came out, every single one of them was sharing on their Instagram everything, because every day at work they were dealing with people yelling at them, and they're like, how do I get across that I'm just here to work? Like, I have nothing to do with this. I couldn't change it if I wanted to. Like, please stop getting mad at me. And I think another, guys, you do so great on this topic is that you spend the time to make those threads of actually explain, because a lot of the misinformation comes from people seeing something, they don't understand it, and then that's when you get all the conspiracy theories, and when you're like, what the heck's going on? What's real, what's not? And I remember one of the first ones that really made me stop, and when it was the day after all the like pie charts and graphs came out, being like, there's only like 1% of outbreaks in gyms, or I honestly forget exactly the details, but it was, and everyone was like, how dare you shut all these down when there's like no outbreaks? And then you guys put out this amazing thread that was like, hey, like, actually most of the there's so much transmission going on, but that doesn't necessarily mean it's coming from an outbreak. So like, while there's hardly any outbreaks in these places, there can be still a lot of transmission, and those are two separate things. And that's something so great. And then again, you were talking about the whole like poop sewer thing, like just explaining things that we as the general public don't see in the news or don't really hear about the details. We just hear the mandates that are going out, and then we're like, well, why is this happening? And then it's harder to do something when you don't understand why. And I think that's such a great thing that you guys are doing with the platform, is like, this is why, like, please understand with us why we're doing this, rather than us just like ordering you.
Yeah, well, and thank you. Even amazing interactions, Ryan Reynolds agreeing to do content with us. Even with all that, the threads are my favorite thing that we've done in this entire pandemic. And again, big surprise, they're evidence-based. The crisis communications is all about that of, look at what we're asking people to do. We're asking you to change your life, change the way you go about your life. At the very least, we need to tell you why. And every single one of those threads, with zero exception, was born out of, something happened, some sort of major shift, a large announcement, and there was a reaction to it from the public that made us be like, okay, I think something's missing. I think there's we've missed something. There's a detail that we haven't quite gotten right. And so then we write the thread and roll back. Like the very first one was mandatory masks, and it addressed asymptomatic transmission. Because if you remember, way back when in the pandemic, the narrative online that public health had said masks aren't good, and then suddenly public health said, no, masks are good, everybody wear a mask. And so when mandatory masks were announced, everybody got upset saying, oh, why the flip-flopping? So we wrote a thread that explained the fact that, first and foremost, the early guidance was, unless you're sick, don't wear a mask. If you have symptoms, put a mask on. And people were wearing masks to try to protect themselves from everybody else. No dice. But then we found out about asymptomatic transmission, and that changed everything. And so then it was, okay, well, everybody could potentially spread this regardless of whether or not they have symptoms. We need you to put masks on, but we need you to put a mask on to protect others from you. It was that fundamental difference that got lost in a lot of the messaging. So the very first thread dug into that. And yeah, the one you mentioned with the pie charts one, that was another one. Sex, drugs, and Santa Claus leading into Christmas was probably one of my favorite ones we've written, because that was the first one that dug into the notion of the gray area between the guidelines and rules. People were like, oh, well, I can have 6 buddies over to watch the hockey game because technically you're allowed to have 10 people inside. And the analogy we used was, the speed limit on the Queensway or on the 417 is 100 kilometers an hour. But if it's snowing, it's not a good idea to do that. And we talk to people through this gray area between guidelines and rules. And then, yes, the wastewater one's great. I'm sure there'll be another one at some point in the next few weeks. They just they all get boring out of watching. And if there's a big enough narrative that needs to be corrected, we'll go do so.
This is a question that came up from me talking to some of my classmates saying, like, what are you interested about? Like science communication and things I could ask you. And this was just a random side one. They're wondering, how long does it take you to sit down and make all these threads?
Okay, so there's a lot. I don't want to undersell what we do, but people are always surprised to find out that it's not a weeks long process. Most of the threads, I'm usually I'm the lead pen on it, and then we have a little thread team. It's kind of we have our general role is 3 sets of eyes for all of our social media, right? There's a content writer, subject matter expert, and a supervisor manager. It's how we move so quickly. There's not 30 layers of approval, but because the threads are more complex and they involve kind of bringing in the messaging from different parts of the team. There's 2 members, Catherine Laska and Nikki Hudson from our media relations team. They're brilliant writers, and I adore working with them. They're amazing women. And they help with those because they can tell us, hey, this is what media is asking, et cetera, et cetera. This is what Dr. Etch's messaging is going to be. There's our supervisor and manager in on it. But, the wastewater one went out on, I think they went out on a Friday, didn't it? Yeah, and I started drafting that at about, right around noon, and I think it went out about 3 o'clock in the afternoon. It was a pretty solid, 3-hour turnaround. Sex, drugs, and Santa Claus was a bit longer because that one was a bit more involved. I think the first draft on that was written the day before. The final edits were done that evening. I think we started working on it at 10 a.m. We had the final edits done at 5 p.m. and then it went for translation and it went out the next morning. So yeah, the threads usually take anywhere from about half a day to a full day to pull together. And it'll just be, you get the messaging into your head. It kind of flows. You are constantly kind of flipping back to, what was that thing that so-and-so said at that tweet, and we'll find the tweet, reread some comments, et cetera, et cetera. But yeah, they usually turn around in about half a day to a day.
Okay, yeah. I have the struggle of even putting out one tweet, maybe a couple retweets a week, and here you guys are with so much content every day, and I'm like, man, the amount of time and effort that goes into it is amazing and so important because it reaches so many people. You can tell just by how many followers you have. And another thing that I love too, sorry, jumping to another side point that you messaged that made me think about it when you're talking about the sex, drugs, and Santa Claus, is the fact that you guys talk also a lot more holistically about the pandemic, and you put out all this information about distress center lines and mental health and how to ID an overdose. And because you understand that there's although the virus itself is what's causing all this, there are so many other repercussions and negative effects that are coming out of this pandemic that a lot of people, I know in the beginning even, especially no one was talking about it. And then there was a couple articles that popped up of domestic violence and child abuse and things because of everyone's being forced at home. And then when the LCBOs were part of the essential things to stay open, people are like, well, why is the liquor store staying open? And then that brought the conversation of, okay, there's people who like truly need this. They have substance dependence. They can die if they don't get their alcohol. And that brought a lot of things to light. And I love that you guys continue to share that, because again, that's something that I find not everyone's talking about. They're so like almost blinders on. We're only talking about the virus. This is the only thing that's bad that can happen. And it's like, there's so many other things we got to keep an eye out for.
Well, and it's based in that, it's rooted in that, that ethos of public health, of harm reduction, and where it's recognizing, social deterrents of health and all the factors that are at play. Mental health is a massive one for us. We probably message about mental health a few times a week. Ben Leakin's the leader of our mental health team, probably one of my favorite people I've ever met in my life. And it, again, it comes back, though. It all comes back to being rooted in those theories of recognizing that this is a difficult time, acknowledging that this is a difficult time, and trying as hard as we can to give people the resources that they need to get through it, and making sure to speak about it. And mental health is, unfortunately, still a rather stigmatized subject, and it's something that we try to break down as hard as we can, and we work very, very hard to bring it out into the open and encourage people to talk about it. And long after the pandemic is done, we're still going to be talking about mental health as much as we can, just because it's it's a part of our day-to-day life.
Yeah, and so prevalent. And I think the more you talk about it, the more people then share their stories, and you're like, holy crap, I'm not the only one. And it's so much more prevalent than I thought when everyone was keeping it hidden,
Mm-hmm.
Which is wild. And so going off of a lot of what your common consensus in terms of all these tweets, like the best way to sort of reach out to people is this transference of like knowledge and the empathy, which I think are huge, a little bit of humor and positivity. Would you say were there any things that you put out that maybe got, I don't want to say huge backlash, but something where you're like, oh, that actually didn't come out the way I wanted it to? Or have you had any stories where you're like, oof, or it has been pretty smooth sailing so far and I don't want to jinx you, I'll knock on wood?
Oh, we have. Our next thread is going to tank. Thank you. I appreciate that. There's been a couple. One of the hardest parts about doing this is, you got to accept the losses with the wins. There have been so many posts that we've written that we thought were just going to be amazing, and they fell flat on their face, and they barely got any reaction. Exactly. It happens. Fun fact, I'm not telling you which one, but there actually was a tweet that went out recently that did very, very well and was quite humorous. And it's actually one that we put out back in the summer on like a Wednesday afternoon, and it died. And we were so grumpy about it that we went back and deleted it and reposted it 2 weeks ago, and it did great. But anyway, we didn't let that one go. But there have been times. We had a post, would have been back late September or October, and it was anybody that's hoping to engage in the sex this weekend, here are ways to do it in a safe way and whatnot. And it blew up, but it blew up simultaneously in two different directions. There were people loving it, saying it was amazing messaging, and then there were people that were very, very upset. You have no business being in our bedrooms, et cetera, et cetera. And we kind of ran with that. And we ended up quote retweeting ourselves later that day. And we wrote a little two-part tweet saying, we use humor when we talk about sexual health because there's evidence to show that humor is the best way to reach younger audiences on heavily stigmatized subject. There's people that believe that sex should only be talked about in the bedroom. It's not something for public discourse. And the reactions to this tweet prove why we do things the way we do, and we will continue to do things the way we do. So we just kind of doubled down on ourselves. But it absolutely happens. It's the nature of social media that there are going to be people that don't agree with what you do and what you say, and you just have to learn how to deal with it on a case-by-case basis.
And it's interesting how much divide there can be. You put the exact same, the same words out, everyone's reading the exact same words, and half the people are going to fully love it, and the other half will find something that you didn't even think could, that could come across in a certain way. Mm-hmm. Would you say that? Would you say that in itself is one of the most difficult things about making sure what you're putting out, rereading it, making sure it makes sense? Would you say that's one of the most difficult, along with or actively seeing all these myths or whatever that might be frustrating to see, and then you're trying to counter that and you're like, how do I give you the evidence to show that like this is what's actually true. Mainly hitting on like the biggest difficulties for you in this position.
Oh, absolutely. I mean, there's so many. The easiest way to counteract. Sorry, it's a little thing. Side note, it messes me up. You're down here on my screen, but my camera's up here, so I keep thinking I'm not looking in the right place. And anybody watching this is going to wonder why I've been looking around randomly this entire time. But I digress. So, yeah, the listening is a good way to deal with that. You can kind of tell maybe when it's the time to be funny and when it's the time not to be funny. You can kind of tell how people feel about a certain topic, and so make sure to massage the wording to circumvent ways that people might come back at it. But yeah, there's a lot of polarizing topics out there, and at the end of the day, it's just a matter of being mindful of it, being as corrective as you possibly can. I mean, for as much misinformation out there, there's also disinformation. There's people that are intentionally trying to steer a narrative in another direction. And for those, it's just a matter of, like we said, that project management from before, et cetera, et cetera. You take it, you deconstruct it. And for the misinformation, it's just a matter of, how do I put this? You need to look at people and say, you know what, you didn't do anything wrong. You're not intentionally, steering people in the wrong way, but you've probably just received bad information, and now it's kind of, led you astray. Like, best example off the top of my head, Annals of Internal Medicine had a study about the efficacy of masks back in probably the late July 2020, and there was a quote from the abstract that got cherry-picked, and everybody was throwing the same quote at us over and over and over again, and the quote was, "There is no direct evidence that masks reduce the spread of COVID-19. But the full quote was, "While there's no direct evidence that masks reduce the spread of COVID-19, there exists ample anecdotal evidence to support their use as a public health measure." And so those were our opportunities to get into, comments and replies with people and saying, hey, by the way, if you read the full study, it's actually for masks. So it's, I'd say the biggest lesson to kind of bring this all back around to the original question is always be listening, always be watching your audience and seeing what they're saying, and try to meet them where they are with your message.
And then flipping it to, I guess, the most difficult things that you've learned coming out of it. I'm sure they'll overlap with my next question, but I kind of want to end on, so a lot of our listeners are doing their master's in like public health or epidemiology, like everyone's, or they're professionals in that, all sort of in the same field. And something that we've actually been asked a lot is asking for advice on how to best then communicate to our peers or our neighbors without, you don't want to get into like some Instagram beef war in the comments being like, no, you're wrong, blah, blah, blah. Like, what I guess would be the biggest pieces of advice that you would give for communicating with those around you and how to sort of give this knowledge in a way. I know you mentioned empathy and like giving maybe like resources as well as like providing the knowledge behind it, but I guess the best approach is found as well.
Yeah, I mean, and there's a lot with that one. There's a ton. I mean, first and foremost, when you're going to be doing stuff like this on social media, you have to be mindful of just how vast of an audience you have. And that's not even like a humble brag of, oh, we have a lot of followers, but it's that nature of social media, right? Like, I didn't read it out for a sec, but there was an article written 1839 in Europe. It was a guy that had just ridden the train for the first time. And when he wrote about his first experience of riding the train, he described it as the annihilation of time and distance. Because at that time, like other cities, like London to Rome, et cetera, they were so far away that you'd never visit them in your lifetime because it would take weeks and weeks and weeks to get there. So they were seen as these places that were so far off that you're never ever going to go there. And all of a sudden, the train comes along, and now you can go visit these places in like a matter of hours or a day, right? So the entire notion of space and time got completely annihilated by that one thing. Social media has done that as well, where now it's not, it's not you're just going to speak to, somebody right in front of you, or you're speaking, in a classroom or delivering a presentation. But when you're putting a message out, you're putting it out to absolutely everybody. People in other cities, other provinces, other countries, all around the world are going to hear that message. And you need to be mindful of all the different ways that separation between you and them will play in. But in terms of, science comms, et cetera, which is similar to like, the public health comms world, when you're communicating to that vast audience, you have to just be mindful of why do we care? You know, like at the end of the day, why do people need to know this? Why do people actually need to know this message? You know, like look at the thread, the poop thread, the most recent one, right? Yes, okay, it was fun and it started with poop and all that, but the why was because, hey, a lot of people aren't really appreciating the gravity of our situation and the severity of all these indicators, and we really need you to appreciate it. So there's always that big solid why before the message went out, and there's that goal in mind. So, you know, people who are doing masters and doctorates and et cetera, you know, start with, why did you start it? You know, even yourself, if you were going to promote this podcast, why did you start the podcast? You know, what need did you identify that made you say, okay, I want to go out and do that podcast? And that's going to be the basis of your comms, because it'll help people, you know, grasp why this is something they need to pay attention to. And there's going to inevitably be comments. There's going to inevitably be people, as you said, wanting to get into it with you on Instagram. And you just have to stick by it. You know, maybe they don't really understand, maybe they don't appreciate it, and maybe sometimes you just need to ignore it and move on with your day. But it always has to be that foundation of, you know, why is it important that your audience hears this message, and build everything from there.
That prompt when you're going about explaining the why, I know in a lot of situations, even sometimes when I'm putting out, like, want to put out a tweet about something that was said, and it's like, in order to say, like, exactly speak about it, there definitely has to be some level of, like, scientific understanding. And then, but then there's the balance of not everyone seeing it is going to have done this much education in public health or science or whatever. And there's a balance of how to communicate the knowledge while also giving enough evidence. And, like, do you have any, like, do you just gauge it and you're like, I think this is about right? Or do you have any tools of figuring out, like, how much evidence is too much to cram into this?
Yes and no. I mean, the shame is, with most of our stuff, it's almost assessed case by case. You know, no two situations are different. The more evidence you can provide, the better. Like, we're lucky enough, like, on the social media side of it, you know, our job is to just kind of get your attention with the basic message. We have an entire website which is loaded with factual-based information and references and evidence, et cetera, et cetera. So we'll send you there so that you can get the evidence-heavy side of it. The social side is just kind of getting that message out in an attention-grabbing way. You sort of you need to gauge it. Whatever you're going to be talking about, you know, how do people feel about it? What's the most common narratives people say against it? What are the most common replies you get from people whenever you talk about subject X? And land in that middle. But it's also, you know, we're also positioned in a way that, you know, we've been doing this on social media and getting, you know, wonderful recognition, which I love, for long enough that we've kind of positioned ourselves as a voice of trust. So we're able to maybe be a little bit more loose with our language and speak more plain language than we normally would, because we have that trust already established. So the early comms that you do, you would probably be much more leaning on evidence. And then when you build the trust with your audience, you'd be able to sway over a bit more towards plain language.
That's a great point. And throw in all the clickbaits.
Yes, exactly. Yeah. You know, read this article or you will die, and just off you go.
It's like those chains where they send in the comments, and it's like you have to like comment back, or your third cousin twice removed.
We did that one, actually. We did that, I think, would have been late June, August, early summer 2020. One of our tweets was, if we believe everything we see online, this pandemic is caused because we didn't send that email to 25 people. And then we just rolled into a little, you know, go here for reliable information post.
Oh my God, I need to start retweeting all those, or, well, I guess too late now. We're already heading into almost the third lockdown, so I guess I missed my opportunity to send that email.
Oh, well, we can do the replies again now. You'd have to reboot your Hotmail account to go, because that's where they all are, but yeah.
Okay, well, this is fantastic, and thank you so much for spending the time and going over this. I know that's big. Science communication in general has been a very big area throughout all this, and it will continue to be as more people now pay attention to public health. With its big rise to fame through this pandemic. I guess you could say that's one benefit that comes out to it. People don't think there's this, one of the guests we had previously made a joke and he was like, yeah, people don't think I study skin anymore, because whenever he'd say he's an epidemiologist, everyone was like, oh, like you're a skin doctor? And he's like, oh, no. So now they understand it.
Right.
All that to say, thank you so much for
at least people are paying attention to science now.
Yeah.
Yeah. No, it would honestly, the world that we've been in has been so ridiculously busy and fast-paced, and being able to just kind of take 30 minutes and talk comms for a while is like wonderful for my mental health. So thank you for, it's flattering if you wanted us to come on, and thanks for giving me the chance to do it.
Fantastic. Well, maybe when the COVID's done, we can revisit the whole science communication and what we learned from the rest of it, and we'll get all the mental health breaks.
Done. I'm in.
Perfect. Thank you so much.
No problem. Take care.
Bye.
Bye.
Thanks for joining us for another episode of Behind the Numbers. If there's a main thing to take away from this chat with Kevin, is that empathy and evidence with a little sprinkle of humor are key tools for gaining trust and engagement in science communications. This was a great chat, and we hope that if you're not already following Ottawa Public Health on Twitter or Instagram, that you go do that now. Their accounts are at Ottawa Health or at Ottawa Santé for the French. And while you're at it, please follow us at Behind the Numbers with no E in numbers. Your support helps us continue with the show. Thank you so much. Hope you all have a great Monday and a great week, and we can't wait for our next episode with you.